Welcome. In this session, we are going to look at the anterior aspect of thigh. And by the end of this session, you should answer the following questions. You should state the cutaneous innervation of the anterior aspect of the thigh and the associated dermatomes. You should know what fascia lata is and the sum of its modification. You should know the muscles of the anterior compartment of the thigh. And by saying know the muscles, I mean you know their origin, insertion, action, innervation. Should also state some clinical conditions related to the anterior aspect of the thigh. Welcome all. My name is Wallace Munyere and I'm the Ure Daktari. Now let's start. Now the cutaneous innervation of the anterior aspect of the thigh is by the following nerves: the ilioinguinal nerve, the femoral nerve of the femoral branch of genitofemoral nerve. You also have the lateral cutaneous nerve of the thigh, or the lateral femoral cutaneous nerve. You also have the intermediate and medial cutaneous nerve of the thigh. Now, here is your ilioinguinal nerve. Here you can see it is emerging from this opening known as the superficial inguinal ring, and it will innervate. It is responsible for the cutaneous innervation of the upper medial aspect of the thigh. Then here we have the femoral branch of the genitofemoral nerve. It mainly supplies the skin over the femoral triangle. Then here we have the cutaneous branch of obturator nerve. Then here you have the lateral femoral cutaneous nerve, or the lateral cutaneous nerve of the thigh, L2, L3. Then here we have the intermediate and medial cutaneous nerve of the thigh, which are the branches from the anterior division of femoral nerve. So these branches are this summarizes the cutaneous innervation of the anterior aspect of the thigh. Now let's look at the dermatomes. Now maybe some of you don't know what a dermatome is. Maybe I can give you state what a dermatome is. A dermatome is the area of the skin supplied by sensory nerves from a single spinal root. So this is the thigh. This region here is the level of inguinal ligament. The dermatome here is L1, here L2, here L3, and you can see the skin on the anterior aspect of the knee, the medial side of the leg, are supplied by L4, here L5. So we are focusing here on the thigh. So L1, L2, L3, L4 medially, L5 laterally. Please understand this image. Like you can draw a question from here. Now let's look at the fascia lata. Now the deep fascia of the thigh is very strong and usually envelops the thigh like a sleeve. Okay, so it is called fascia lata. Why is it called fascia lata? Now, latas is the Latin word of broad. Now, because this fascia lata usually encloses a wide area or a broad area, that is latas in Latin. So they named it fascia lata. Its attachments are as follows. It has superior attachments and inferior attachments. So the superior attachment on the front of the thigh, it is usually attached to the anterior superior iliac spine. Then it is attached to the inguinal ligament and the pubic tubercle. Then laterally, it is usually attached to the iliac crest, and posteriorly through the gluteal fascia to the sacrum, coccyx, and the sacrotibial ligaments. Medially, it is attached to the pubis, pubic arch, and the istiotuberosity. Those are the superior attachments. Then inferior attachments is inferiorly, it is attached on the front and the sides of the knee, and it is attached to the subcutaneous bony prominences and the capsule of the knee joints. Those are the attachments of the deep fascia of the thigh, the fascia lata. Now, what are some modifications of the fascia lata? The fascia lata has some modifications, namely the iliotibial band or the iliotibial tract and the saphenous opening. So let's start with the iliotibial band. Now, the fascia lata is usually thickened on the lateral aspect of the thigh to form about 2 inches wide band called the iliotibial tract or the iliotibial band. Now, superiorly, along the iliac crest, now this iliotibial band usually split into 2 layers to enclose the 2 muscles. So it will enclose the tensor fascia lata and the gluteus maximus. Then, in between those muscles is a single thickened sheet known as the gluteal aponeurosis, which covers the gluteus medius muscle. The superficial lamina is attached to the tubercle of iliac crest, and the deep lamina of this iliotibial band is attached to the capsule of the hip joint. Inferiorly, the tract is attached to a smooth area on the anterior surface of lateral condyle of tibia. Now, this smooth area is some text will refer it as the Gaddy's tubercle. Maybe I try to write that. Gaddy's, a G, E. I'm very poor at writing this using a mouse. Gaddy's, R, D, Y. Sorry for that apostrophe. As Gaddy's tubercle. So the Gaddy's tubercle is that smooth area on the anterior surface of the lateral condyle of tibia. So Gaddy's tubercle. Now let's continue after that. The upper part of the iliotibial band usually provides the insertion of the 2 muscles. Remember, the 3/4 of the muscle fibers, usually of gluteus maximus, insert into the iliotibial band and also the tensor fascia lata. So maybe as the name says for this muscle, tensor fascia lata, it will tense the fascia lata. Now, here it is. As you can see here, it is splitting to enclose gluteus maximus and the tensor fascia lata. Then in between you have the gluteal aponeurosis, which will cover the superficial surface of gluteus medius muscle. Now, what is the functional significance of this band? It will stabilize the knee both in extension and in partial flexion. Hence, it is constantly called into action during walking and running. When one leans forward with slightly flexed knees, the iliotibial tract is the main support of the knee against gravity and prevents the individuals from falling forward. I think these marathoners, long race runners, some of them usually complain of pain along the lateral aspect of the thigh. That is, maybe, let's say you have the iliotibial tract has become too stretched, so it will cause some problems. So this is the functional significance of the iliotibial band. Now let's look at the other modification of the fascia lata, the saphenous opening, which is an over opening the fascia lata in the upper medial part of the front of the thigh. So it is an opening of the fascia lata, which usually cover the roof of the femoral triangle. Now, the saphenous opening is closed by a membrane of areolar tissue, which is pierced by numerous structures, hence it is sieve-like. So that is why it is called cribriform fascia. Cribriform means sieve. Cribriform, you meet it elsewhere, like in the there is a part of we have a bone in the skull which is known as ethmoid bone, which has perforations which allow the olfactory nerves to pass from the nose into the cranial cavity. So it has those piercings. It is called the cribriform plate. Though this is the cribriform fascia, but cribriform means sieve-like. And the structures which pass through the saphenous opening are these: the great saphenous vein, superficial epigastric artery and vein, superficial external pudendal artery and vein. And we also have some few lymphatics, lymph vessels which usually connect the superficial and the deep inguinal lymph nodes. So let's look at now the muscles of the anterior compartment of the eye. Now, this is the extensor compartment. The anterior compartment is also known as the extensor compartment, since these muscles are knee extensors, the primary knee extensors. And it is bounded laterally by the lateral intermuscular septum and medially by the medial intermuscular septum. And it is composed of the following muscles: the quadriceps femoris. Quadriceps means four heads, four muscles, four heads of the, remember seps means heads, like biceps, bi means two, triceps three, quadriceps four. So four heads. Then we have another muscle known as articularis genu, sartorius muscle, your longest muscle in the body, tensor fascia lata. Now, quadriceps femoris is named so because it consists of four parts, which include the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. It is supplied by femoral nerve. Those muscles are supplied by femoral nerve, and it forms most of the bulk of the anterior aspect of the thigh and is the most powerful extensor of the knee joint. So let's look at them. Here we have the muscle. Maybe I should move this here down for you to see first. Here we have a muscle, origin, insertion, nerve supply, and the action. Now, quadriceps femoris, four muscles: rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. Origin: rectus femoris has two heads, straight head and a deflected head. Straight head originates from the upper half of the anterior inferior iliac spine. Deflected head usually originates from a groove above the acetabulum. So this groove, some texts usually defined as the supraacetabular groove. Since it is above the acetabulum, supraacetabular groove. It inserts into the base of patella and via the patella ligament, it will insert into the tibial tuberosity. It is supplied by the femoral nerve, action, flexion of the hip, but extension of the knee. All of them perform one action. These four quadriceps femoris. Vastus lateralis usually originate from the upper part of the intertrochanteric line, anterior and inferior borders of greater trochanter, the lateral lip of gluteal tuberosity, and the upper half of the lateral lip of linea aspera. And it will insert into the base of the upper 1/3 of the lateral border of patella, and into the also inserts into the an expansion of the capsule of the knee joint and the iliotibial tract. Supplied also by the femoral nerve. These are supplied by a posterior division of femoral nerve, extension of the knee. It usually extends the knee only. Only the rectus femoris. Rectus femoris, since it is crossing through two joints, it crosses both knee and the hip joint. It is the only one which can flex the hip, but the others are they cross only one joint, the knee joint, and they extend it. Vastus medialis originates from the lower part of the intertrochanteric line, the spiral line, medial lip of linea aspera, and the upper 2/3 of the medial supracondylar line to insert into the base and the upper 2/3 of the medial border of patella. Now, these fibers which usually insert into the upper 2/3 of the medial border of patella, you find some text calling those fibers as the vastus medialis obliquus. And those fibers are very, very important. They play a key role in the stability of the patella. that we will look. It also inserts into an expansion of the capsule of the knee joint. And after inserting into the base of patella, they usually they usually insert into the patella is connected to the tibial tuberosity by the patella ligament, but some texts usually say that is a patella tendon because patella is a sesamoid bone. Sesamoid bones are bones which are embedded into tendons. So we should look into that. Then vastus intermedius originates from the upper three quarters of the anterior and lateral surface of the shaft of femur to insert into the base of patella and via the patella ligament into the tibial tuberosity, innervated by the femoral nerve, extension of the knee joint. Now we have this muscle, articularis genu. It originates from the anterior surface of the lower part of the shaft of femur to insert into the synovial membrane of the knee joint. In fact, some text will tell you it inserts into the suprapatellar bursa. Suprapatellar bursa, it is an extension of the synovial membrane, and what is its action is to pull. It usually pull the synovial membrane in knee joint, in the knee joint during extension to prevent the bursa from being crushed between the two bones. So when the knee is flexed, the suprapatellar bursa lies between the two articulating surfaces, but during extension, the articulating surfaces come into contact. So if we don't pull it, it might be, let's say, it might be crushed between there, but the articularis genu prevents that. Then we have sartorius. Maybe sartorius, we look at in the page. So sartorius, let me take this down here. Sartorius, here we have origin, insertion, innervation, and action. So sartorius, this is a very important muscle. Now sartorius, sator is the Latin of tailor. Okay, so why was it called sartorius? From the word tailor, sator. A sator is a tailor. Sator is the Latin interpretation of the word tailor. So it originates from the anterior superior iliac spine and the upper half of the notch below it, and to insert into the upper part of the medial surface of the shaft of tibia. It usually insert into via the common tendon, the pes anserinus. Remember, the pes anserinus is the common tendon of sartorius, gracilis, and semitendinosus. It is innervated by a femoral nerve. Its actions are flexion of the hip and the knee joints. So it affects both hip and knee joints and laterally rotate the hip. Now look at this tailor here. Now ancient tailors used to sit like this. With the, you can see here, the hip is flexed, the knee is also flexed, and the thigh is laterally rotated. So that is how tailors used to sit when doing their work. So sator. So, and these actions are being performed by the sartorius muscle. So that is how the muscle got its name. And you can see this is the same position. Here the hip is flexed. So the knee is flexed here, and the thigh and the thighs are laterally rotated. So this is the Parvi position. The Parvi position. Maybe you should look at the Parvi position, the one which is usually adopted by Indians when eating. You can look at that. Then we have the last muscle, tensor fascia lata. It originates from the outer lip of iliac crest and the anterior superior iliac spine to the tubercle of iliac crest to insert into the iliotibial band, innervated by the superior gluteal nerve, and its action is abduction of the hip joint. So it usually helps the hip abductors to prevent sagging of the pelvis on the unsupported side. So, but some texts usually say that tensor fascia lata was originally a muscle of the gluteal region. Then during evolution, it migrated as man adopted an upright position. So that is why even they support that by since it is innervated by superior gluteal nerve, which is a nerve of the gluteal region. Okay, well, let's believe in them. Then here we are. Now this is your sartorius muscle. You can see it here. Here is your tensor fascia lata. Here you can see this inserting into this. This is the fascia, the iliotibial band. Then you can see here we have the quadriceps. This here you can see vastus lateralis, rectus femoris, and this you can see it is the this is the vastus medialis. Vastus intermedius is deep to this. Like here, you can see we have cut the sartorius and somewhat reflected just the sartorius you have cut. To show you, maybe here it is crossing the rectus femoris at the closest two joints. It will cross both hip and knee joint. So, but it will flex the hip joint and extend the knee joint. Okay, there you go. Now here you see I've cut this rectus femoris to expose deep to it. We have the vastus intermedius. Okay, and these are their origins. Here is where sartorius originates. Insert here at the upper medial aspect of tibia via the pes anserinus, and rectus femoris has two origins. The straight head originates from the anterior inferior iliac spine, whereas the reflected head originates from the supraacetabular groove, and they will insert here. They will insert into the tibial tuberosity. First, they will insert into the base of the patella. Then the patella ligament connects the apex of the patella into the to the tibial tuberosity. Then we have vastus lateralis, vastus intermedius. Then here you can see the vastus intermedius. Then articularis gen will originate here and insert into the suprapatella bassa to usually prevent the impingement of the suprapatella bassa during knee extension. Maybe you can, these images are very important. Here you can see the adductor hiatus. Maybe that is for another time. Then what are some clinical correlations? Now, the lateral cutaneous nerve of the thigh, or the lateral femoral cutaneous, remember root values L3, L4, is sometimes as it exits the abdomen into the thigh, it usually passes through the inguinal ligament. It might be compressed as it passes through the inguinal ligament, which will lead to pain and paresthesia. So this is the correct spelling. Maybe you should look at that. In the upper, it will cause pain and paresthesia in the region supplied by the nerve, which is the upper lateral aspect of the thigh, which leads to a clinical condition known as melalgia paresthestica. So how will you relieve this pain? So a surgical treatment is required, where we divide the inguinal ligament to release the nerve from compression. So that is how you relieve the pain of melalgia paresthestica. So I think we have come to the end, guys. Thank you for your attention, and subscribe for more anatomy and biochemistry content. Thank you.